Speaker, also to the Minister of Health and Long-Term Care, we have a problem in our riding. Simcoe doctor is retiring with a roster of 4,600 patients and has no successor. This exacerbates an already fragile situation. Also in June 2013, another example, a Port Dover physician with a roster of 2,000 retired, again without a replacement. Over the years, I've met with a committee trying to build a new health centre in Port Dover. They're enthusiastic, but they need doctors. I wrote you January 22nd seeking possible solutions. I await a reply for that letter, Minister. And Minister, I'm asking, could you provide us with some advice, some action to help our community down in Norfolk County to attract physicians and also to help attract physicians in other underserviced areas?
Thank you. Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker, and I appreciate the question from the member opposite. It is a very important issue in terms of physician supply around this province, and it can be challenging in certain parts of the province, more challenging than in others, to gain that supply of physicians. It's so important to provide that primary care support to the residents. We have a number of initiatives that are underway, work by Health Force Ontario that specifically targets underserviced and regularly serviced areas that are facing challenges with regards to physician supply. We also have a program called Healthcare Connect that aims to attach unattached patients to new family doctors. But, Mr. Speaker, it's important as well to recognize that we have made significant progress in this province in terms of both attachment of patients. We now have about 94% of Ontarians who do have a regular primary care provider. That's a physician, but it may also be another primary care provider. And in the supplementary, I'll talk to other investments that we've made.
Thank you. Supplementary.
Yeah, thank you, Minister. And I feel that both there's a Norfolk General Hospital recruitment team and also this Port Dover committee. One option I feel is they need an empty family health organization to enable them, to better enable them to attract doctors. I'm also told of a need for an additional health organization in West Norfolk, down in the Port Row and Delhi area. Minister, you have indicated previously in question period you would like to see more family health teams in small towns and rural Ontario. However, I understand there's a cap allowing something like only 20 new family doctors a month in the entire province. We graduate something like 500 a year from Ontario's medical schools. To summarize, in Norfolk, we need another 14 doctors according to a formula. My question, Minister, why will you not create new family health teams or other empty family health organizations, for example?
Thank you. Minister.
Well, thank you. And well, I know the member knows that I was born in Norfolk General Hospital, so this is a part of the province that I know very well, and he's acknowledging that. There's no plaque. And but this is a very important issue, and Mr. Speaker, the fact is that there's in the last 10 years there are 2,300 more family doctors practicing in this province than were before. That's almost 25% increase. But there is still more work to be done. Nothing prevents family doctors, for example, if that's what we're talking about, setting up shop anywhere in this province. They can do so through fee-for-service. They can create a family health group as well, where they can get together with other family doctors. They can work as locums as well. They can replace a retiring physician, for example, in a family health team. But also, we have allocated 20 spots per month for underserviced areas around the province, and we've specifically looked to our LHINs to identify for the purpose of deploying these family health team doctors, of identifying what parts of the province should be included. It may be that this part of Ontario is part of that designated area. We should know in the next several weeks.
New question, the member from Renfrew, Nipissing, Pembroke.